So when you eat too many carbohydrates, and a lot of people think, well, wait a minute, carbohydrates, that's bread and potatoes and beans. Yes, that's right. All those carbohydrates are made of sugar. And all fruits contain high amounts of sugar. When you turn that fruit into fruit juice, you actually increase the concentration of the sugar even more. And so we're built, we're omnivores. There's no doubt about that. We're able to handle some small amount of sugar in our diet, and it's not going to lead to much disease. But when you're eating too many carbohydrates, which break down into too much sugar, you overwhelm your liver's ability to cope with that. And one of the ways that it deals with that is, especially if you're drinking lots of fructose or eating too much fructose, it's going to store that sugar in the liver as fatty streaks, which can be seen on an ultrasound or a CAT scan or an MRI. When there's enough fat in these fatty streaks in your liver, then you're going to start having elevations in your ALT, your AST, and your GGT. These are basically the signal lights on your liver's dashboard saying, hey, you're doing something to me that's unhealthy. I don't like it. Please stop that. That's anytime those numbers are elevated, even if they're a little elevated, never let your doctor say, oh, it's just a little bit. It's probably nothing. We'll recheck it in 6 months. If any of your liver enzymes are elevated, that's a big problem. That needs to be thoroughly investigated. And an answer and a plan of remediation needs to be come up with before you leave that doctor's office. So when you put these fatty streaks down, it causes chronic inappropriate inflammation inside the liver. It causes the liver to not function as optimally as it could otherwise. It causes the blood flow through the liver to be hampered to some degree. That's why it can build up back pressure to the heart and lead to heart failure. It just causes a cascading disaster sequence to happen in your entire body because, as I said earlier, and all your listeners have remembered this, the liver is very, very important.